Luke and I were in Kansas City recently and did a keynote presentation for the organization that um, targets massage therapy education. And what I thought I would do is briefly um, go through that PowerPoint with all of you, get it recorded so that you all have a idea of current situation and then some future trends that are coming up as you prepare for your own career. Luke and I did this presentation in front of about 100 educators. That's not an excellent representation based on the number of teachers and educators and continuing education out there, but it was a very good group. And there were some influential people within the group that we hope will kind of, we're at a critical spot right now with where the massage profession occupation is going to go, and it'll impact all of your futures on where we end up. And I'm even though sometimes it sounds like I am frustrated, I'm actually quite confident in how massage therapy will evolve and the options you'll have for your own professional practice, which we'll cover a little bit today too. So Luke was the future and I was the past. So some of these are just fun slides that I'll slip through kind of fast. So here's one. I do want to point out that that's me at 2. And I was a child of the 60s. I do not remember the 80s. I don't know what happened, but I started practicing massage in 1970, between 1978 and 1979. So, trying to go between what was, what is, and what will be, it's a constant adaptive demand, just like we have on our bodies when we start a new activity or we're recovering from a solar flare or whatever. So this was some fun pictures. That's Luke as a baby. And over here is Luke as a kid. And I was young once. This is Luke when he graduated from the program. So he truly has been around his whole life, which is kind of fun. When you speak as an authority, you should come from a place of been there. And so this is just a little bit of capturing the 40 years of, how I have been involved and watched the profession grow. This little thing here, endorsed curriculum, is a process of making sure that there is a little bit of oversight to how we do this through one of the professional organizations called the Commission on Massage Training and Accreditation. Another time I'll explain the difference between endorsement and accreditation. Accreditation has really fallen apart in terms of creating a level of excellence for the schools like it was way back in the day. And it's part of the whole financial aid conundrum, which I don't get involved in that. It has too many problems with it as far as I'm concerned, and the ability to provide an education that stays up to date and has some flexibility to it. And every one of our students at some point requires a level of flexibility. So, and we're obviously in an area in the middle of sometimes nowhere. And, that also keeps the perspective on the types of clients. This visual, I think, is extremely important. It helps discern where entry level is and your commitment to professional development. And I think I've used this picture before. They're both chairs. These are both chairs. And when you complete your entry level program, you will be able to create a chair with massage. It'll be functional. It will be useful. And over time, you will be able to refine it and make it beautiful. And one of the points that we have issues with at entry level across the globe, not just here in the United States, is understanding and allowing this process of professional development, putting unrealistic expectations on entry level education. Um, Instead of focusing on the foundation, interspacing too many things that are either a niche or based on some sort of multi-named fancy continuing education thing or whatever, and it never allows the student to own the foundation. And without a foundation, it doesn't matter how pretty it is. Even though this picture over here is beautiful, it's still a chair. And it takes time to get to that. And I think sometimes there's too much pressure put at entry level education and not enough support for that next 2, 3 years after graduation to let people learn from doing. That's the question I asked. Are we all in the same boat? I have no clue. These are just some fun pictures of community over the years. Some of my favorite people over here. Some of my influencers, some of the people that have had an influence on me. This is Dr. Leon Chadow, and he was taught at the school. I wrote with him. He was a European trained osteopath, naturopath, acupuncturist. He traveled all over the United States and Europe teaching, wrote just hundreds of books, some of which I wrote with him. I had the opportunity to spend over 20 years learning from him. And one of the things I admired from him is that he was an integrator. He didn't try to carve out a uniqueness. He always wanted to bring it down into overlapping concepts. He didn't brand name anything. He didn't try to set himself up as a guru of any type. He didn't ever pretend to have all the answers. And he had a huge influence on me. This is Dr. David Girovich. I may have mentioned him before, but he had a huge influence on me. Not nearly as well known as Dr. Chadow, but the influence was equally important as far as I'm concerned. And he immigrated to the United States as a refugee when the Berlin Wall came down. He was actually a surgeon in the during World War II for Russia, and a paratrooper dropped behind the lines, and then worked for many, many years as a physical medicine specialist who's an MD, medical doctor, in St. Petersburg. But during the turmoil of the Cold War and other issues, Russian Jewish Relocation Services was able to get him, his wife, who was an obstetrician, and his son out. And he couldn't bring his medical credentials with him. And so we were contacted, and this was back in the 80s. And he taught at the school and taught me, and just, had a quiet presence that I will always be thankful for. And bless his little heart, he and his wife were expert tango dancers. It's kind of fun to know a little bit behind the scenes on all of that. But we are influenced. We absolutely are influenced by people. And you want to make sure that you own whoever you're influenced by. And you're influenced by me. You're uh influenced by Luke. You're in front of us as part of your entry level exposure. You're influenced by each other. You can't get away from that. So it's important for you to vet your influences. No matter how hard anybody tries, they're going to be biased. I try to call myself out on that, but I don't always. And I want to encourage all of my students to uh, be discerning, be discerning in the information that you believe, and know that it changes. Information changes all the time. And there's an obligation for us to stay up to date with all of that. So this is just fun. Look at that big hand. That's one of the basketball players. These are a couple of football players, NFL characters I worked with. This is Charlie Batch. I still see this character. He has gone on from 17, 18 years playing in the NFL to heading up a just very influential community-based program in his hometown that reaches out to underserved populations and provides all kinds of support, and very active on a local level. And it's nice to look back and go, at some way I've been influential in all of that. We want to own what we have done good too. That's not bragging. That's appreciating. This is a picture that talks about the defunct Alliance for American Football. Luke and I were involved in creating a nationwide massage therapy application for these athletes. And Luke and I love to say the massage program excelled, the league went defunct. It went bankrupt. But what it did for us is expose us to massage therapists and massage education. Again, Luke had this too when he traveled with the Pistons all over the country, and where their similarities were and where there was problems. And there's Luke at the Pistons. Isn't he cute? He's looking very serious. And I like to laugh at the lamp. This was Luke's attempt at atmosphere and ambiance, which is very important part of what we create for clients. It's part of the therapeutic effect. And where we performed massage was not always, a beautiful setting. But Luke hauled that lamp around, so it was dim and quiet. This happens to be at a period of time where we were working in a storage room. So an example of being adaptive. Other influences, including for you, your life, things that have happened to you, things that you've overcome, things that you deal with on a daily basis, will also influence your professional career. And this is just a couple of pictures. This was when I had the heart surgery years ago, and look at how young Luke was at the time. And then more so than that, what has influenced how I personally practice is the vision issues that I have and how I've had to adapt around all of that. And again, just, there's Luke having to be a model, and there's when he graduated from Siena Heights, and there's his first edition of the textbooks. And I think I've posted this picture for you before because I love that picture of Luke. He doesn't necessarily, but I do. So this is something that I brought out that is important for all of you and anybody else that is listening to this, and that is, where does massage therapy education live? And how does that influence how the education is delivered and where the focus is? Back in the day, and some of you could possibly remember this, is that if you didn't go get a college education, you were really looked down upon. It was not thought that without a college education, a bachelor's degree or whatever, you would never be able to succeed. Thank goodness in recent years, the importance of vocational skill-based education has increased and is now respected. And it's even more where there's economic stability within the vocational sector. And when I talk about that, I'm talking about health technician, not the doctors and the PTs and all of that, but a medical doctor needs 100 vocationally trained people to be able to perform this day, that each have a specific skill set. God forbid you're trying to find a plumber these days. They're just they're so far behind, or a construction, somebody who knows how to build something, a cook, somebody who is able to fix, not program, but be able to fix a computer, mechanics. And so the importance of vocationally based education is finally getting the accolades it should. And that's what you're in. You're in a vocationally based private school sector overseen by the Department of Education in Michigan. And in fact, they're supposed to visit the school tomorrow to pay attention to oversight on what's going on with this. But I just want to point out that your choices to pursue a vocational education is a good choice. It's a good choice to do that. And there is a pathway towards academic degrees if you want to do that. But I want you to be proud of the decision that you made to provide yourself with skills based in this educational sector. These are just students. You're students, you know what you do. Of course, this is my teaching. You also have had to experience that. But there's Luke taping Laura's belly, and teaching hydrotherapy and some of the stuff that we do. This is also an important slide, something that we're grappling with on an international level. What does the research really show that supports manual therapy? And massage is a form of manual therapy. This happens to come from a chiropractic study done in 2024. So when we think about research, we want to make sure that we're looking at things that are current. That doesn't mean there isn't a legacy that goes back. You'll see that in the textbooks. Sometimes there will be a string of references that starts maybe back in the 60s and then carries through and shows development through to a more current. When I write textbooks, I like to reference the newer things no later than 5 years previously. So just keep that in mind when you're looking for research. But this paper really nailed it when it talked about what manual therapy does and the importance of it. So I'll read this piece to you. It says musculoskeletal conditions are the leading contributor to global disability and health burden. My neck aches, my knee aches, my back aches. I stiff all over. That. Manual therapy interventions are commonly recommended in clinical guidelines, and massage is in those clinical guidelines, especially for, this is more in a medical realm, especially for pain, and used in the management of musculoskeletal conditions. This is where it gets important, and where I struggle in the textbooks and I struggle in the classroom on where to put the focus in your education. Traditional systems of manual therapy include physiotherapy or physical therapy, osteopathy, chiropractic, and soft tissue therapies. That would include, that would be where massage therapy would live, have been built on principles such as clinician-centered assessment. That means you go into somebody and they tell you what's wrong by doing all of these mechanistic type tests, which we're teaching you. We will teach you some of those because they're good for determining if there needs to be a referral or something. Patho, starting from the pathology, pathoanatomical reasoning. And one of the things that we try to teach is that you, during your assessment processes and massages assessment, that you look for what's right, not always what's wrong. It's amazing that any of us can get up and function on any day when you consider what our pasts have been like. I told you the story about me falling while I was gone. So I'm currently dealing with a funky knee, right? But the rest of me is doing just fine. And so one of the things is being understood in chronic conditions is that people become over focused on what's wrong and they don't appreciate how they're adapting and how they're functioning and what they're doing well. And massage therapy is one of those places that we can reinforce that. But that's not typically how it's done. And if you look at the continuing education market, one of the things that you will find is it's all about finding and fixing. And one of the premises we want you to have is reinforce and support. And then it's all about the technique, and it isn't. There are a lot of things can get the same result. And we'll talk more about this technique specificity. And there's just hardly anything in the manual therapy world that trumps or goes over top of the idea of a good solid compression, with feel good pressure, and most techniques are built off of that as a foundation anyway. And then importantly, these historical principles are not supported by the current evidence. And that is really making people uncomfortable, because this is how they have built their sense of value, is that I can find what's wrong and I can fix it. And it just isn't working that way. However, data from clinical trials supports the clinical and cost effectiveness of manual therapy as an intervention for musculoskeletal conditions when used as a part of a package of care. And this is why we want you to understand interdisciplinary care and to learn to speak a language that's cross-discipline. So things like medical terminology and how to chart and document in a way that can be understood across to discipline and to appreciate and understand your scope of practice along with the scope of practice of others. So, things like Luke's lamp in the storage room, all right, a level of ambiance, a level of continuity of approach, safety and comfort and efficiency, communication, listening to the client, focusing on the client. That those are the things more than your technique, or at least equal to your technique, uh, that will be a really important part of why you have so much value in working with people. But we still teach muscles. I mean, we have to because it's important. But I think that there is an overemphasis on muscles, and I'm not going to change this. I can stomp all I want. Um, there is a platform that what we do affects muscles. It probably doesn't. It does affect movement. It does affect soft tissue texture and continuity and pliability and all that kind of stuff. But sometimes, in the global scheme of things, in a vocational education that is less than a year, we have to choose what we're going to focus on. And I think we clutter the broad educational process for massage. We clutter our education with some detail that maybe isn't where the focus should primarily be. Now, bless your hearts, use that legacy, that information lag, is going to show up still in the licensing exam that you're going to take. And so you're going to have to recall the individual names of muscles and where their attachments are and all that kind of stuff. So, and it's not going to hurt you to do that. But when I was talking about it, this figure over here, I pointed out death by muscles. So sometimes you just have to learn stuff because it's on the test. It just is. You can complain about it all you want and won't make a difference. Unless you want to move into a leadership position in the future and be committed to the long-term time it takes to make these changes. And then you graduate. Aren't graduates cute? And we had to, this picture was how the pandemic finally brought massage therapy education into the current age and why we're able to teach you effectively on Zoom right now. Not everything, but there was tremendous resistance against technology in massage therapy education. And now most of the programs include some sort of a platform. And the use of electronic materials like the ebooks for your textbooks. So sometimes a bad thing can actually end up with some really good outcomes, and this was one of them. There's still resistance. There's teachers that have been around a long time that don't understand the technology, and so they resist it. Not because it's bad, but because they don't know how. And you've got two choices with inevitable change that you're going to have to adapt to. You can find somebody that can do it for you, or you can learn to do it yourself, or you can combine it. But you can't ignore it. So one of the big things is what is entry-level education? What do you need to know? And this is a question we're going to come back to. So ponder. How advanced can you get as a massage therapist and still stay within scope of practice? And what do you think is reasonable for you to be able to do upon graduation? Just kind of put that in the back of your head. In the massage therapy community, these are some of our major issues. I think I spelled role. That should be ROLE. Oh, well. Massage therapy community has a lack of unified vision. We cannot agree on entry-level curriculum standards. The professional organizations will not endorse a cohesive career path. We misspell role, and we don't know what the role of continuing education is. We don't understand what specialization is. We do not have a unifying terminology. We do not do our own research. We have to rely on other manual therapy professions to do our research. We do not present the autonomy of how you can practice massage upon graduation, and all of the choices you have with self-employment and an employee or a combination. And the teaching of body mechanics and ergonomics is just terrible. Um, you you have to be able to be efficient and effective. And there's so much stuff that people are taught in entry-level education that does not support practice longevity. Fortunately, that's not your case. But you got to be careful. I have to monitor my body mechanics constantly because you fall into bad habits if you don't do that. And then we also still have the problem ongoing with illicit sex businesses and trafficking. We still have that as an issue. You can't deny it. And I am the tortoise. I've been around forever, and these issues have been around forever. It's the thing I said at the conferences is that it's a travesty that my generation is leaving this issues to the future to solve. We we should have solved these, and we didn't. So there you go. So this is the slide, whoops, for the professional organizations. And I have posted a YouTube on all the different ones. There's a million of them. It seems like they all have an acronym to them. They don't work together. And individually, the massage therapy community needs to put pressure on this. This is huge. This trickles down and impacts each of you. So the membership organizations are the American Massage Therapy Association, AMTA. That's the true nonprofit professional membership organization. They offer insurance and conventions and that sort of thing to you. We have given you a student membership to this when you enroll. You should be getting stuff from the AMTA. Another one that provides equally good resources, but is a for-profit organization, is the Association of Massage and Bodywork Professionals, ABMP. Because they're a for-profit business, they're able to be what's called nimble. Something changes in the profession, they can adapt quickly. The AMTA cannot because of its nonprofit status. There's a lag with that. These two organizations compete for your money. They compete for you buying a membership for insurances, your malpractice insurance and that sort of thing. So, and there's a big long history on how they all formed and all of that. And I don't want to take time for that today. But they have not worked together well. And they are the conflicts between the two are a big problem. Organizations that you'll also want to know about for what's your future includes is the Federation of State Massage Boards. Not that you can join that. Michigan joins that, Minnesota joins that, Wisconsin joins that. These are state, this is an organization that represents state regulation, these massage licensing boards. But they create the NBLEX exam. That's where the NBLEX exam comes from. And most states use that exam as a licensing exam along with other licensing requirements. So when you get ready to graduate, one of the things that you're going to have to do is register for and take and pass the NBLEX exam, Massage and Bodywork Licensing Exam. In addition to that, you have to comply with state regulations, which is a background check and fingerprinting and all of that kind of stuff that goes with it. We'll work with you through that when it gets closer to graduation. Another organization that you will be interested in post-graduation is the National Certification Board for Therapeutic Massage and Bodywork. They offer a credential called board certification that says, I am not a beginner. It's voluntary. You don't have to take it. It's over and above licensure. It's a for real certification. And it is used, if you want, to transfer credits to Siena Heights University to pursue an associate's or a bachelor's academic degree in massage therapy, if you want to do that. Two other organizations that influence what you're doing are Commission on Massage Training and Accreditation. I mentioned them with our endorsed curriculum, but they set the standards for what competencies are for entry level. And then there's another one called the Alliance for Massage Therapy Educators, and that's where Luke and I were speaking. They don't directly affect students and entry-level practitioners, but they indirectly do by influencing what is taught, both in entry-level education and in continuing education. And then the last one is the Massage Therapy Foundation, which is where the understanding of research and the research arm lives. And they have been very quiet lately. And the important thing they are working with right now is a continuation on studying ergonomics and body mechanics. So that's a big issue on why massage therapists are not having a sustainable career. So let's see. So most massage therapists are graduating from schools like Health Enrichment Center, individually owned private for-profit massage therapy schools. Community colleges about 10, 15 years ago were trying to move into the educational segment, and it hasn't persisted. And major schools that teach multiple programs in the vocational sector, Dorsey is an example. There are other career-based schools. They jumped in big time and then realized that they really pushed the access to financial aid, and then the federal government came down, you may or may not remember, with predatory education, and they pulled their financial aid, and a bunch of terrible things happened and all of that. So the the private owned for-profit massage therapy school is the one that's persisted. So here's your career pathway. This is something I want you to pay attention to, and then it'll go in the back of your head, and we'll talk about it when you get closer to graduation. You have to um, choose quality massage education. You did that and pass the NBLEX exam. We will work with you more as time goes on. The way the curriculum is laid out and all of the practice tests and looking at all the videos I post and all that stuff is what does this. Some people are good test takers and some people are not. And so hopefully over the time, we'll work away at that anxiety around test taking with this. That's mandatory. Everything else below this is optional. You can do it or not. You can begin massage practice as an employee or self-employed. I don't recommend self-employed initially. You have to have another whole set of skills related to business. But if you have been a business owner and you understand things like overhead and the time it takes to maintain the facility and all that kind of stuff, then you're halfway there to being successful as self-employed, opening your own business. If you're not, and you're not good at that, and you know that you're not going to be attentive to all of the peripheral stuff that goes on behind the scenes to maintain a business. These days, there are many opportunities and really good opportunities as a career as an employee. So this is a good thing. Sometimes people start as an employee and then they pick up a few clients on their own and are sort of self-employed, and then they may even go out into their own business. And then they may even then start to hire employees. So we talked about that a little bit last month. You can become board certified. I mentioned that. And you can develop a specialization. You can learn more about working with people who are aging, the aging population. And there's a lot of us. And so that specialization would require not more information about massage, but more information about the aging process. What challenges are there for those that are older? Is there going to be a financial concern for disposable income so that they can pay out of pocket? That's where the specialization comes from. So in my opinion, specialization chooses you. You find during the first 3, 4, 5 years of practice that there are clients that you connect with and the client connects with you. And over time, you will find that they have a shared set of criteria. So over time, I found myself with a bunch of athletes. That was never my intention. And it wasn't what I worked with in the first 10 years of my career either. But over time, the way I think, the continuing education I had, the influences of Dr. Chadow and Dr. Girovich and others set me up so I could understand how to work with people that use their body like that. So specialization, I think, will find you. If you want a college degree there, you can do it. I've explained how you can do that. And if one of you, two of you, may actually want to move on and become a researcher. And if you want to do that, that's usually a doctorate degree. And I suggest that you move from your bachelor's in applied science and massage therapy to a master's degree in communication or education or something along those lines, psychology. And then if you want the doctorate, go for public health. That's where the bigger picture of massage therapy is living. And two of our major researchers in the massage therapy community, that's where their doctorate is in public health. So there's Luke. You can talk to him. He did this. So did Logan. All right. Sarah has her bachelor's degree in exercise science from Saginaw Valley or Central. I don't remember which, but you don't have to do this, but it's nice to know that you can. Right now, there are all kinds of external influences that are influencing massage therapy scope of practice, what the licensing laws look like, what the body of knowledge looks like, and they are moving to define what massage is, where it's going to have benefits, and how it's going to be incorporated more than we are doing from the inside. So that's not necessarily a bad thing. If we haven't been able to figure it out in 40 plus years, what's happening from the outside, in my opinion, is not necessarily a bad thing. So I'll show you some examples. One is a job description that was done by the Veterans Administration. It took them 22 plus years to actually create a job description for massage therapy. It's not perfect, but it's really good. And in it, it outlines a definition and an entry-level point all the way through a series of steps and progression. So you start out at what they call Government Service 5, and here's what they determined an entry-level therapist would be able to do. They perform basic massage therapy services under close supervision. That makes sense to me. The technician, they call it a technician. That's just their terminology. The technician functions independently in applying basic massage services and include a variety of terms here. Effleurage is gliding. Stroking is gliding. Petrissage is kneading. This is an example of the weird terminology overlap that we have. You're going to have to know this. Effleurage, petrissage, to Pullman are specific to the Swedish massage system, not massage in general, but these terms overlap. These are things that you're all being taught. They're responsible for changing linens, refilling oils, cleaning, and providing a clean, calm environment. Health technician promotes and educates patients. This is a healthcare thing. This is in the VA hospital system. In the health and wellness benefits of massage, and develops therapeutic relationships with the person, family, significant others by demonstrating sensitivity and respect for the person's personal beliefs. Well done. And deviations from regular procedures, unanticipated problems, and unfamiliar situations are referred to a supervisor for decisions and assistance. Isn't that cool? That you don't have to necessarily be out there on your own. Just yesterday, we had a person come in with a broken arm and a broken scapula, and the staff had me to go to. That's nice to have that instead of being out on your own trying to figure it out on your own, like I've had to do for many, many, many years. But each of those situations taught me as well. Figuring things out on your own is how you learn. Any unusual client interactions are documented, and you've got some place to go to. Some assignments at this level include developmental duties involving more progressive care, designed to prepare you for the next higher grades. Isn't that nice? And then it goes on to the next level where increasingly you act more autonomously and in more complex situations until you're eventually a supervisor. if you want to go that high. So this model could be incorporated in any employment situation, not just the VA hospital. What frustrates me is that the massage therapy community, the inside part, that doesn't even know this exists. That's just incredible. That's incredible to me. This is something we don't have to create. It's already done. We just maybe have to change a little bit of the terminology. You know, the old don't recreate the wheel. We also don't have a good appreciation of what professional development after entry level involves. And there are some real problems here. One of them is modality naming. You know, so some of you have heard of, I'm going to do muscle activation technique, or I'm going to do myofascial engagement, or I'm going to do trigger point toe tapping. I don't know. And the other thing is that an educator cannot certify you in anything. So there's a big disconnect between understanding these two terms, certificate and certification. And while they seem like the same word or the same concept, in the bigger world we live in of healthcare, they are absolutely not. And so a lot of people say, oh, I'm certified. You might have heard this. I'm certified in prenatal massage. No, you're not. There isn't one. It doesn't exist. You have taken classes. Great. You got a certificate for taking those classes. That's proof that you've had the education, but you're not certified. That's an external process outside of the education. So just, we'll come back to this, but keep in the back of your mind when you are looking at professional development, if any of the people you're thinking about taking a class from tells you they're going to certify you, run. They know better. Every single continuing education provider out there knows they are not certifying, and yet they still do it because certification sounds fancy. And this is one of the things that we've got a problem with when we try to integrate into the broader healthcare and wellness situation. And these are just some pictures of how you know, it's really all the same, you know, and that divides us. This is a real problem with us being able to move forward, the whole us and them situation. And that the professional organizations have got to stop this conflict and communication. And I suggested strongly that they all are locked in a room. The leaders are all locked in a room with subject matter experts and an external unbiased consultant, and they're not let out until they come out with a for real something that's called a professional practice framework that defines all of this stuff, which other occupations have. It's not a new concept. So why we haven't done it, I don't know. Drives me nuts. Maybe you can put some pressure on the professional organizations, you know, by writing them a letter or an email or calling them up and asking some of these questions. We also have research outside of the massage community that is influencing us, and that's a good thing. And this is coming out of the National Institutes of Health, and that's a good thing. I've pointed out some of this research to you already. One of their big issues is a unifying language. That's one of their mandates, is to try to find a unifying language so that we can share research. So these are some of the things that they're looking at right now: terminology and measurement of force-based manipulations. So a force-based manipulation is when you apply a force to the body, which is exactly what massage does. And they're including massage therapy in these research. Massage is not, the Massage Therapy Foundation is not actively engaging. But these individuals are reaching out to massage therapy to try to be inclusive. They're trying to identify underlying neuromechanisms. They're trying to look at the bigger picture on how a generalized process like massage creates a physiological response that supports health. And they're trying to come up with technology that can actually measure this stuff. Good stuff. External influences. I'm involved in this a little bit through an organization called the International Consortium on Manual Therapies. And I sort of got in the face of the participants and the leaders and said, why are you not involved with this? I said, I've talked about it. I've put it out there. There's been webinars. You know about it. Some of you attended those things and you didn't do anything. But I did, and I'm proud of it. And you're lucky it was me speaking for the massage therapy community. I don't know if that's when I fell or not. So this is the study I was involved in. There's my little name. I'm very happy about that. But when I speak like that, and I speak firmly, I'm coming from a place of knowledge, just not just opinion. I mean, I have my opinions, but when I'm really forceful, it's coming from a base that I can back up. And we're not going to be able to work together unless we are willing to work with multidisciplinary collaboration. I am of an opinion that we can prepare you to make career decisions in entry level. But to prepare you from scratch on how to go out and start and manage your own business is over and above what we can do at entry level. We can show you what you need to learn, and the business chapter that we went through does that. But to expect a school with 625 hours of vocational education to teach something that's usually seen as a bachelor's degree is unrealistic. And as a result, a lot of people go out, try to start their own business, and they're not prepared. And it breaks my heart when somebody has potential to be an excellent massage therapist, but they fail because they're not necessarily prepared for all of the business stuff. And this, I want to do it my way, and I want to be an entrepreneur, and all this other kind of stuff is wonderful. But it can get in your way as well. So the franchise system as an employment really has rocked the career pathway for massage therapy as a career pathway. Now we are moving out of a franchise model, but we're still operating as an employee, multi-person massage therapy, wellness, spa, clinic, whatever. And so the franchise system in general has really made a huge impact. It just wasn't the buy-up of Massage Green by Hand and Stone just did not fit our demographic. It's not that I have anything against the franchise model in general. In fact, I'm very, very supportive of it. And a franchise may be where you get your first position. And it should be run well. These are all individually owned locations. They're small businesses. And if you're going to be an excellent employee, you deserve to work for an excellent employer. And if they're not, don't work for them. Else, eventually, the bad apples will weed themselves out. Vice versa. Massage therapists overall, the reputation of massage therapists as employees and team players in this environment is terrible. They are not necessarily team players. They don't understand what the overhead costs and the risks are for the employers. They don't show up. They don't, they call in at the last minute. They don't follow the professional dress codes. I mean, the list goes on and on and on. And I don't want anybody that graduates from Health Enrichment Center to be a terrible employee. There's no excuse for that. Of course you do the laundry. Of course you help clean up. Of course you step up and help with the marketing. Of course you participate in promotional activities. Of course you do that stuff. So there. And it's if you're going to be part of a team, then you have to be part of the bigger picture, and you don't bitch for the sake of bitching. If there is something that needs to change, provide suggestions. You may not have enough information to know why something may or may not work, but at least it stimulates the conversation. Don't gossip. Don't bring your trauma into the classroom. God, we've all worked with people that every time you turn around, they're spewing their trauma everywhere. We all have had things, all of us, and we can be kind and we can be compassionate and we can be supportive and we can know that sometimes people have bad days. But there are people that like to manipulate you and draw you in to their world. You've probably all worked with somebody like that. And then their problems become yours, and you don't want to do that. So you just don't listen to them and you get up and leave. And if you have an issue with management, talk to the management, not fellow employees. And yes, we all want a self-directed life, and we want, work-life balance, and we want to be able to feel productive in our professional growth. But we are part of a bigger community, and we don't live life independently. Everything we do influences somebody else. And hopefully that's in a kind and general and compassionate way. Massage therapists are being taken advantage of by not understanding what this all means and what the reality is in all of this. Especially the persistent and ongoing problems with people being classified as independent contractors. If you work for yourself, you are self-employed. If anybody else is sort of in charge of what's going on, and this runs rampant in chiropractic, as well as non-franchise massage clinics, non-franchise. Franchise massage businesses do this right, but non-franchise clinics will do this, classify you as an independent contractor, so they don't have to pay payroll taxes on you. It is not to your advantage. So if somebody says, when you go out and look for a position, if somebody says, I'm going to classify you as an independent contractor, they are almost always, if not always, operating illegally, and you should be an employee. You won't get in trouble by being misclassified. The employer will. They're gonna have to pay all the back taxes, they're gonna have penalties, they're gonna have all that kind of stuff. But a lot of massage therapists stay in this gray area because they won't demand that they are treated appropriately as employees, and they won't report. They won't go to the federal government and ask for an evaluation on whether or not they're truly classified, because we don't want conflict, and it's easier to just ignore it. And I don't blame you for that. But we are part of the problem when we don't demand that we are treated correctly in the sector. And then the other thing they say is that you make more money being self-employed, and you don't. You have two jobs when you're self-employed. You're the massage therapist and you're the business owner. And every business owner should make a profit. So if you're doing two jobs, you should have the income of two jobs. But that doesn't mean you're making more as a massage therapist. The second part of that bump in income, if you have it, is because you're making profit because you're a business owner. So if you're working full-time as a massage therapist, which is 20 to 25 hours in a 30 to 35-hour work week, and you're also a business owner, you're working a 60-hour work week, 50 at minimum. And when you're an employee, you don't do that. You've got that other time that you would be focusing on your business is time that you can focus on other things, including another part-time job if you want to. So that's what this is about, and I'm not going to spend time with it because we have it in the textbooks. I will say that one of the frustrating things massage therapists in general do is think that they work extraordinarily hard physically. And this is a physical occupation, but it's not any more physical than somebody who is waiting tables or working on a road crew or doing construction or taking care of kids. It's got, I'm just not going to go there with, I should be paid more because it's a hard job. And you can't work part-time and expect full-time wages, which that's kind of out there. The AFMTE most recent report says that full-time employees are making, this is without tips, are making about $40,000 a year. Self-employed are down. So a part-time employee is making less than a full-time employee. Duh. That's kind of a duh, right? And we make more than a lot of other vocationally trained people in the health profession. So, and we talked about the living wage calculator. This is the study that's being done about ergonomics. They should be in phase 2. Let's hope that they are. And then finally on this, because there's still this connection with illicit sex businesses and trafficking, which is organized crime, massage therapists are in danger. Where we are subject to people making inappropriate responses or thinking that we're going to do something sexual or whatever. And the leadership organizations are not doing a very good job at protecting the massage therapists. Shame on them. There's been a lot of focus on massage therapists being the perpetrator, where they inappropriately touch a client or sexually molest a client or something, but that's actually relatively rare compared to the amount of times massage therapists are solicited by people for sexual services. And if you're in a employee situation in the future when you graduate, the employer should protect you from that. That's one of the advantages of being in an employee situation. Doesn't mean it won't happen, but you've got somebody that's got your back. When you are self-employed, you're your own employer, so it's up to you. And one of the things that should happen is if you are accosted or if you are solicited by a client in any situation, is that the police should be called. Sexual solicitation is a crime, and you want the business you work for or yourself, if you're the business, to have a good, solid relationship with your local law enforcement. And then this is from your textbook, that because we have this unfortunate association, we need to be clear in the very beginning, from the very beginning, that we establish the boundaries, have a picture like this right in prominent, that they sign off on it, the whole thing. So, and then this is just some other kind of ideas with this. This is the gist of the presentation. And I left it with, it is different than it was. It is, and it's better. I think it's better. I think those of you that are going to be moving into the massage community have it better than those of us that came up in the 80s and in the 90s. Massage has not changed. How we practice massage is changed. And so that has to come forward in the teaching.